I oversee planning for the city's social services. I work at the Department of Human Services, or Human Services Agency in San Francisco. My passion is the history of the city, the history of low-income people in the city, and the city's responses to people who are in poverty, people who are suffering. So in that context, I'm here tonight to support Family Services Agency where I worked years ago, and also to talk about Katharine Felton. And Katharine is the grandmother of the city's social services.
She didn't stop there, because after a year of doing this, she said, well, wait a minute, these are poor moms. They just need to work. Why are we taking their babies, their children, and paying somebody else to provide care? Why don't we help those families out and let the children stay at home? This was in 1907.
I started at Family Service Agency as a young man, I was working my way through college, I think, and I became a case manager, working with families that had children with disabilities, and later I became an outreach worker, helping families that were affected by crack cocaine addiction in the 80s and early 90s, trying to help the families come into treatment, try to stay out of foster care. So those were very formative years for me, and I'm always grateful to the agency for those opportunities. And I had people like Ira Oken who were mentors to me. And I also, through that experience and starting with such a storied organization, had a sense over time, maybe I'm older now, have a sense of building on the work of people who came before me, and knowing that people who come later on are going to build on my work, and just having a sense of continuity between generations of social workers who have been working in these same neighborhoods, working with these same challenges, from homelessness to parental addiction, for 100 years. So I definitely feel a connection to the agency, to Katharine Felton, to the challenges that we share.
1918, she led a statewide ballot initiative for single-payer health care in California. It didn't pass, but she was a hero during the earthquake, during the 1918 flu pandemic in San Francisco. Heroic stories that she led that saved many, many lives in San Francisco. And she was the head of FSA until 1940 when she passed away. And I today feel like I'm building on her legacy.